Many injuries can occur on land at an aquatic facility, including skin and soft tissue injuries, burns, injuries to bones and joints, and even bleeding emergencies. When caring for an injury at your facility, follow these general care guidelines. Activate the EAP, size up the scene, and form an initial impression. Use your senses to check for hazards that could present a danger, use appropriate personal protective equipment, determine the number of victims, determine the nature of the illness, and form an initial impression to determine if a life-threatening emergency exists, such as unresponsiveness or severe bleeding. Ask yourself, does the victim look sick? Is the victim awake and moving? If the scene appears to be unsafe, move to a safe distance, notify additional members of the safety team, and wait for their arrival. Following the scene size-up, including forming an initial impression, conduct a primary assessment to determine if the victim has any life-threatening conditions, and if so, summon EMS personnel if a call has not already been made. If no life-threatening conditions are found, perform a secondary assessment and care for any conditions you may find. Any injury to the soft tissues, such as the skin, fat, or muscle, is called a wound. Closed wounds occur beneath the skin's attached surface. Bruises and internal bleeding are examples of a closed wound. An opened wound is one in which the skin is broken. This can include an abrasion, laceration, avulsion, or puncture wound. Open wounds can lead to external bleeding. Remember to always apply appropriate personal protective equipment before coming in contact with a victim. Most external bleeding injuries that you encounter will be minor, such as a small cut that can be cared for by applying direct pressure over the wound until the bleeding stops, cleaning the wound, and applying an adhesive bandage with a wound gel or antibiotic ointment. Major wounds do not stop bleeding on their own. To care for a major wound, activate the EAP and have someone summon EMS. Then, cover the wound with a sterile gauze dressing and apply direct pressure over the wound using the flat part of your fingers. You can ask the victim to apply direct pressure. If blood soaks through the first gauze pad, place another pad on top and apply direct pressure if necessary. Cover the dressing with a roller bandage and secure it directly over the wound. Check for circulation beyond the injury. If the wound bleeds through, do not remove the original bandage. Apply additional dressings over the soaked bandage and apply direct pressure. If a wound still won't stop bleeding, follow local protocols when considering other methods of bleeding control. Care for other conditions that may develop, including shock. Any serious injury or illness can result in shock, which is a life-threatening condition in which the circulatory system fails to deliver enough oxygen-rich blood to the body's tissues and organs. Signs and symptoms of shock include restlessness or irritability, altered level of consciousness or LOC, pale, ashen, cool, or moist skin, nausea or vomiting, rapid breathing and pulse, and excessive thirst. To minimize the effects of shock, ensure EMS personnel have been called. Have the victim lie flat on their back. Control any external bleeding. Help maintain a normal body temperature. Monitor the victim's condition and watch for changes in level of consciousness. Administer emergency oxygen if it is available and you are trained to do so. Never give food or water to a victim in shock. Comfort and reassure the victim until EMS personnel arrive and take over. A burn is another type of soft tissue injury that can also occur at aquatic facilities. Heat, radiation, chemical, and electrical. Depending on the source and severity of the burn, you may see redness, blistering, or charring. To care for a burn, remove the person from the source of the burn, then cool the burned area with large amounts of cool or cold tap water for at least 10 minutes. If cool or cold water is not available, use a clean cold compress. If a dry chemical caused the burn, first brush the chemical away with another object before flushing the area. Cover the burn loosely with a sterile dressing and take steps to minimize shock. Comfort and reassure the victim and instruct them to seek follow-up care. Environmental conditions can cause heat-related illnesses or cold-related emergencies, even without extreme temperatures. Heat cramps, heat exhaustion, and heat stroke are progressive conditions that can result in death. A victim suffering from heat cramps or heat exhaustion may experience painful muscle spasms, cool, moist, pale, ashen, or flushed skin, a headache, nausea, and dizziness, weakness and exhaustion, and heavy sweating. If the situation progresses to heat stroke, their skin may be hot to the touch, wet, dry, red, or pale. They may not be sweating. The person may experience changes in level of consciousness, vision disturbances, and seizures. The person may vomit, experience rapid and shallow breathing, or a rapid, weak pulse.
Amanda, I'm a lifeguard. Can I help you?
Yeah,
To care for someone suffering from a heat-related illness, move them to a cool place. Loosen or remove clothing as appropriate. Cool the victim, and if they are responsive and able to swallow, encourage them to drink small amounts of a commercial sports drink, coconut water, or milk. If the victim refuses to drink, vomits, or has a mental status change, vision disturbance, or a seizure, summon EMS personnel immediately and take steps to rapidly cool the victim as soon as possible. If it is safe to do so, immerse the victim up to their neck in cold water and continue to monitor them for breathing and a pulse. Cold-related emergencies include hypothermia and frostbite. Hypothermia occurs when the victim's entire body cools because its ability to keep warm fails. Hypothermia can progress into a life-threatening condition. Prompt action at the onset can prevent body temperature from dropping to dangerous levels. A victim who has hypothermia may seem indifferent, disoriented, or confused. You may notice that the victim has a glassy stare. Initially, the victim may shiver, but as the hypothermia progresses, the shivering may stop. This is a sign that the victim's condition is worsening and they need immediate medical care. To care for someone suffering from hypothermia, gently move the victim to a warm place, remove any wet clothing, and warm the victim with blankets or by putting them in dry clothing. Be sure to cover their head. Monitor the victim's condition, watching for changes in level of consciousness, and summon EMS if necessary.
Hi, I'm a lifeguard. Are you having trouble breathing? Yes. Do you have asthma?
Sudden illnesses and injuries can occur anytime, any place. As a lifeguard, you may encounter many types of sudden illnesses, including diabetic emergencies, fainting, seizures, and stroke. In any first aid emergency, you must decide how best to respond to the situation, including when to activate the EAP. Consider the following when deciding how to act. Should I provide care where the victim was found, or should they be moved? Is the safety of the victim or others compromised? Is there a risk of further injury to the victim? Is there a risk of exposing the victim or others to pathogens? Should I summon EMS personnel? When should I recommend that the victim see a healthcare provider to seek further medical treatment? To assess a sudden illness or injury, apply personal protective equipment and perform a primary assessment, asking for consent if appropriate. Care for any life-threatening conditions and use the sample mnemonic to obtain history. If no life-threatening conditions are found, perform a secondary assessment. If you think something is wrong, don't be afraid to ask questions. Look to see if the victim is wearing a medical ID tag that can give you more clues.
Stomach pain ever happened to you before?
No, this is the first time.
It's the first time.
Many sudden illnesses have similar signs and symptoms, including lightheadedness, dizziness, or changes in level of consciousness, including confusion, altered mental status, or unresponsiveness. Other signs and symptoms include nausea or vomiting, difficulty speaking or slurred speech, numbness or weakness, loss of vision or blurred vision, changes in breathing, changes in skin color, sweating, persistent pressure or pain, diarrhea, paralysis or an inability to move, or severe headache. Although you may not know exactly what is wrong, guidelines for caring for any sudden illness are generally the same. Summon EMS and provide appropriate care.
He's looking pretty sick. Will you call EMS?
I'll go call EMS right away.
Monitor the victim's condition and watch for changes in LOC. Keep the victim comfortable. Reassure the victim and keep them from getting chilled or overheated. Be sure the victim is fully awake, able to swallow, and follow simple commands. Intake is indicated based on the treatment recommendations before administering any food or drink as part of care. Care for any other problems that develop, such as vomiting. Remember that the victim's condition may worsen rapidly. Call EMS as appropriate.
I need you to call EMS. I have an adult here with a severe allergic reaction.
People who have diabetes may become ill because they have too much or too little sugar in their blood. A person having a diabetic emergency may experience changes in LOC, confusion, irregular breathing, abnormal pulse, feeling or looking ill, and abnormal skin characteristics. If a person is having a diabetic emergency and is awake and able to swallow, give 15 to 20 grams of sugar in the form of glucose tablets to the victim. If not available, 15 to 20 grams of sugar from several sources can be given, including glucose and sucrose-containing candies, jelly beans, orange juice, or whole milk. Monitor the person's condition. Call EMS if the person loses consciousness or is unable to swallow, or if their condition doesn't improve within 10 to 15 minutes of taking sugar, or if the victim feels worse after taking sugar. During a seizure, a person may lose consciousness and experience sudden, uncontrollable muscular convulsions lasting several minutes. Breathing may become irregular and even stop temporarily. A seizure is also considered a possible sign of cardiac arrest, so the victim should be assessed and monitored closely. If a person is actively seizing, activate the EAP and remove nearby objects that could cause injury. Protect the person's airway and allow the seizure to run its course. Attempting to stop the seizure or restraining the person can cause injuries. Do not place objects or fingers into the mouth of an actively seizing person. If the victim is responsive and breathing normally, but not fully awake after the seizure is over, check the victim for injuries and place the victim in the recovery position. Reassure the person as you monitor their condition. If a person has a seizure in the water, summon EMS and support the person with their head above water until the seizure ends. Remove them from the water as soon as possible after the seizure, positioning them on their back. Perform a primary assessment and provide appropriate care. A stroke occurs when blood flow is blocked from reaching part of the brain or when there is bleeding in the brain. A stroke can cause permanent damage to the brain if not treated soon after the onset of signs and symptoms, so time is critical. Common signs of stroke include sudden weakness or numbness of the face, an arm, or leg, usually only on one side of the body. Other signs and symptoms include difficulty speaking, blurred vision, severe headache, dizziness or confusion, loss of balance, and ringing in the ears. Use the FAST mnemonic to help identify and care for a stroke. F stands for face. Ask the person to smile. This will show if there is drooping or weakness on one side of the face. A stands for arm. Ask the person to raise both arms in front of themselves to find out if there is weakness in the limbs. S stands for speech. Ask the person to speak a simple sentence and then listen for slurred or distorted speech. T stands for time. Time is critical. If someone demonstrates any of these symptoms, call EMS immediately. Because sudden illnesses can have serious complications, it is important to continually monitor the victim. For example, people with severe allergies could quickly progress to anaphylaxis, and from respiratory distress to respiratory arrest. As you assess what's happening, be sure to summon EMS personnel immediately. If the victim knows of their condition and has medication with them, help the victim access their medication right away. Continue to monitor the victim's condition even if they have taken medication while you wait for EMS to arrive. If the victim has already taken the medication, help them administer a second dose only if EMS is delayed and they are still demonstrating signs and symptoms of anaphylaxis 5 to 10 minutes after administering the first dose. Help the victim maintain an open airway if necessary. Asthma, a chronic condition in which the airways swell or become blocked as a result of various triggers, can also have serious complications. During an asthma attack, breathing can become progressively difficult, even resulting in respiratory distress. If you suspect someone is having an asthma attack, assist the person with their prescribed quick relief medication, usually an inhaler, if requested and if permitted by state or local regulations. After assisting with the asthma inhaler, continue to monitor the victim's condition. Call EMS if breathing does not improve. When something is lodged in someone's throat, the natural response is to cough. If the person is coughing forcefully, they are getting air. Encourage them to keep coughing.
Keep coughing.
If an adult or child cannot cough, or has an ineffective cough, or cannot speak or breathe, they might be choking. Call for more advanced medical personnel and obtain
I'm a trained
consent.
medical responder. May I help you?
Position yourself to the side and slightly behind the victim. Place one arm diagonally across the chest. Bend the victim forward so their upper airway is at least parallel to the ground. Using the heel of one hand, give 5 firm back blows between the victim's shoulder blades. If the object has not been dislodged, give 5 abdominal thrusts. Stand behind the victim and, while maintaining your balance, make a fist with one hand and place it thumb side against the victim's abdomen, just above the navel. Cover the fist with your other hand and give quick upward thrusts. Continue delivering a combination of back blows and abdominal thrusts until the object is forced out, the person can cough, speak, or breathe, or the victim becomes unresponsive. If the victim becomes unresponsive, gently lower them to a firm, flat surface and immediately begin CPR starting with compressions.
Bend forward.
If you cannot reach far enough around a choking victim to give abdominal thrusts, or if the victim is obviously pregnant or known to be pregnant, use back blows and chest thrusts to try to dislodge the object.
Stand straight. Bend forward.
You might need to kneel behind a child to give effective back blows and abdominal thrusts. Do not use as much force with a child. If an infant cannot cough, cry, or breathe, perform a series of 5 back blows and 5 chest thrusts. Position the infant face down along your forearm, supporting the infant's head and neck. Lower the infant onto your thigh, keeping their head lower than their chest. Using the heel of your hand, give 5 firm back blows between the infant's shoulder blades. If the object is not dislodged, position the infant between both of your forearms and turn their face up. Lower the infant onto your opposite thigh, keeping their head lower than their body. Place 2 fingers on the center of the chest, just below the nipple line, and give 5 chest thrusts about 1.5 inches deep. Continue giving 5 back blows and 5 chest thrusts until the object is forced out, the infant begins to cough forcefully, cry, or breathe on their own, or until the infant becomes unresponsive. If the infant becomes unresponsive, place them carefully on a firm, flat surface and begin CPR starting with compressions. Cardiac emergencies are life-threatening and can happen at any time to a victim of any age, on land or in the water. When a person is in cardiac arrest, quick action is crucial. The cardiac chain of survival describes 5 actions that, when taken, increase a person's likelihood of surviving cardiac arrest. There is a cardiac chain of survival for adults and a cardiac chain of survival for children and infants. Let's take a look at the cardiac chain of survival for adults. First, there is recognition of the emergency and activation of the emergency response system. Then, early CPR, followed by early defibrillation, advanced life support, and integrated post-cardiac arrest care. Lifeguards and the safety team play a major role in completing the first 3 actions in the cardiac chain of survival. The first link in the cardiac chain of survival, recognition of the emergency and access to the EMS system, gets help on the way quickly. The sooner you recognize that a person is in cardiac arrest and summon EMS personnel, the sooner advanced medical personnel will arrive. Early CPR is the second link in the cardiac chain of survival. CPR helps to circulate oxygen-rich blood to the brain and other vital organs, helping to prevent brain damage and even death. The third link is early defibrillation. The electrical shock delivered by an AED may help reestablish an effective heart rhythm, significantly increasing the person's chances for survival.
Analyzing rhythm. Everyone stand clear. Shock advised.
The fourth link is early advanced life support, which is provided by EMS personnel at the scene and on the way to the hospital. Integrated post-cardiac arrest care is the final link. After the person is resuscitated, medical professionals work to stabilize the person's medical conditions, minimize complications, and diagnose and treat the underlying cause of the cardiac arrest. The pediatric cardiac chain of survival is slightly different from the adult cardiac chain of survival. Because cardiac arrest in children often occurs as the result of a preventable injury, such as drowning, prevention is the first link in the pediatric cardiac chain of survival. The second link is early CPR, and the third link is activation of the EMS system. Just as in the cardiac chain of survival for adults, advanced medical care and integrated post-cardiac arrest care are the last two links of the pediatric cardiac chain of survival. Medical professionals can provide the knowledge, equipment, and medications to continue the life-saving care you have already given. In a cardiac emergency, when every second counts, responding quickly using the 5 links in the cardiac chain of survival can mean the difference between life and death.